Hello everyone, my name is Muhammad Taqiyyuddin Bin Md Halim. I am a Bachelor Honors in Occupational Therapy and also a Diploma in Occupational Therapy. Today, I am here as an occupational therapist from Little Angel. So, today I'm going to present on behavior and why it happened according to the book Jane K. Smith, 7th edition. So there's a quote on the next page where it says, every child behavior is a story to be told. I want you to think about the quote first. I am going to present 5 general things. The first one being descriptions of behavior, which means that the behavior, what is it and its purpose. Second, factors affecting behavior. There are two main factors. The first one is the internal and the external. Number 3 is why challenging behavior occur. Okay, challenging behavior is different than just normal behavior, as you can see. We can say it as inappropriate behavior. Okay, another one is how to reduce the challenging behavior. But before we can reduce, we need to understand why it happened in the first place. And lastly is support good behavior. For the first one, descriptions of behavior. Behavior happens. So, what is a behavior? It is an expressive act by an individual that can have different form and meaning. In other words, it is a way of communication. Like what I just did just now. This is called body language. This is one of the type of behavior, body language. We can also see our eye where we can give side eye. Those are called behavior. So it is a way of communication and it depends on the other person whether they can or cannot understand. Okay, so that is a description for behavior. Next one is factors affecting behavior. Okay, if you remember what I just said, there are two factors. The first one is the internal, second one is the external. So let me go one by one in for the external first, because external is something that we as an adult can control because it is the environment around the children. So there are 4 things for the external factors. The first one, task demand greater than the skill level, and then change in schedule, unfamiliar person, and unfamiliar places. Okay, so for the task demand greater than skill level, here it means that if the task or the play is a bit harder than the children can do, they will start showing the behavior. Okay, another one is internal factors. For internal factors, as you can see here, I highlighted 3 items, which are the desire for control, poor emotional regulation, and poor sensory processing. These 3 are some of the common ones that we can always see. So, other thing is fatigue, illnesses, ineffective communication, or in other words, non-verbal children or children who is having difficulties to talk, pain, and poor self-regulation. So what's the purpose for challenging behavior? The 3 items for the children can cause challenging behavior. So why it happen? Why challenging behavior happen? 4 things. First is the children is trying to obtain item or event. Number 2 is trying to avoid a situation, or in other words, escaping. Number 3, escaping from an undesired object, event, or demand. And then lastly is sensory function. Okay, for sensory function, um, if you guys want to know, it is recommended to go to a practitioner such as occupational therapist to get the assessment for sensory issues. If the children have sensory issues, they can show a challenging behavior. The 4 purpose for challenging behavior can translate into 2 types of challenging behavior. The first type is passive. Second type is active. For the passive, we can see the children can get non-compliance, which means he or she won't adhere to our instruction. withdrawal, avoidance, inattention, and lack of response. Withdrawal meaning that the children will try to not do the activity or the situation. And then for the avoidance, he or she will try to not join or participate in the activity or the playtime. Inattention means that the children will not be, it's just that the children will have a hard time or difficulties to pay attention to complete the task or toys given. And lastly is lack of response, where the children will not respond to any of the command by the adults. Okay, another one is active. Okay, active challenging behaviors called is one of them is direct refusal to engage, means that he or she will try to say either no, which is very loud and clear, or through tantrum. Tantrum means that he or she will cry and scream non-controllable. And then another one is opposition, where he or she will try to do the opposite things or will try to challenge or just directly refuse what the adult is trying to make them do. Aggression, trying means that he or she will try to hit or try to throw table or throw the toys, etc. And lastly is self-injury. Some of them can be seen by pulling their hairs out or just scratching their arm and maybe some biting and also biting. Okay, so for number 4, how to reduce the challenging behavior. There are generally 6 ways. So the first one is minimizing undesirable event, sharing control, matching demands to ability, supporting self-regulation, increase communication effectiveness, and clarifying expectations. Okay, so I'll go through one by one. For the first one is minimizing undesirable event. Okay, so oftentimes we as an adult always overlook the child as a whole, which here it means that the child personality, likes and dislike, the sensory issue if there is one, and etc. So as an adult, it is our responsibility to correctly identify which of the personality for the patient that affect the children behavior. Okay, so next one is matching demands to ability. So matching demand to ability means that if the activity for the children is a bit too hard, the children will get easily frustrated. However, if the activity is a bit too easy, the children will get easily bored. So how do we know? It depends on the children. So let's say there are 2 age group. The first one is 3 and above, and the other one is 3 years and below. So let's say the 3 years and above can do 4 to 5 pieces puzzle easily. But for the age group 3 years and below, can't do the 4 to 5 pieces puzzle, but instead they can only do 2 to 3 pieces puzzle easily. So you can see over here, if they want to join the activity, they don't have to do the same activity. The two of them can play same thing, but different level of difficulties. For example, the child from 3 years and below can do up to 4 pieces puzzle. However, for the 3 and above years old, can do up to 6 or 7 pieces puzzle. It depends. There's no need for them to do it a very hard activity because it will demoralize them. Another way is increase communication effectiveness and clarifying expectation. As an OT, we can use picture cues. Okay, what is this picture cues? So picture cues is for the children. Let's say the children is nonverbal, but he or she still have needs and want. So what can we do is one of them is picture cues. What is picture cues? Picture cues is basically an everyday item that is always interact by the children or being used by the children in picture form. For example, if the child wants milk or fries or nugget, they can go to the specific picture to indicate that they want that particular things. So that is picture cues. It is a way of communication for the children. However, it is not the only way for the children to communicate. Okay, next one is clarifying expectations. Okay, when clarifying expectation means that when the similar activities are made on daily, the children can know what to be expect. Hence, they will create their own comfort zone. This give them a sense of familiarity. So, when in that situation, let's say there's a specific routine in the house, you can set a specific clear rule. So, for example, let's say at 8 to 10 a.m. is for them to play around or play with their toys. So what you can do is that only play toys in this area. And then the last two is sharing control and supporting self-regulation. Okay, for sharing control, okay, let the kid decides on what to get or do. So for example, let's say the children likes to play toy car, so it's okay, just let them choose it, but the way they play is by arranging them in straight line. So we as an adult can give them options on how to expand the play activity. So what we do here is we play with the kids, and by that we can explain how to play it. So for example, instead of arranging them in straight line, play them normally as a car should be. So maybe make a little race with a two car, or play the car and then move to rough terrain such as your own body or the furniture at the house. That is basically give them options and ideas how to play the toy car. Another one is supporting self-regulation. Okay, supporting self-regulation, before I said if it's a sensory issue, children have a sensory issue, it is highly recommended for you guys to go and meet an occupational therapist to get a sensory issue assessment, because through that we can determine which part of sensory issue that is currently affecting the children. So like stated here, sensory issue can cause challenging behavior. Let's say for example, the children is very sensitive on tactile and oral, which translate into very picky in food choices. So that itself is a behavior issue when the parent is trying to expose the children to a new texture of food. The children will either do one of the two types of the challenging behavior that I just showed previously, the passive one or the active one. What are the initial steps to handle this? Okay, first and foremost, you need to rule out the pain and illnesses, because if the children is currently having pain and illnesses, it is definitely going to have a behavior issue if the adults trying to push the children to adhere what they are trying to say. So next one is creating a calm atmosphere. Means here that keep the physical environment clean and predictable. Doesn't need to be large, doesn't need to be too small. Just need to be clean and predictable. Means that everyday item that the children is interacting, usually the toys, is on the place where it is easily reachable and can be seen. But the off limit item, let's say TV remote, is kept in the box and hidden away from the children. Another one is establishing routine and consistency. How do we do this? Is by making a simple daily activity checklist. So let's say every day is almost the same. The child wakes up in the morning, let's say at a fixed time at 8 a.m. And then after waking up, he or she needs to brush his or her teeth, and then afterwards go and have breakfast or take a shower, and then afterwards play. Each and every single one of the activity have a checklist to be done. So after done one activity, the children can tick or just put a sticker on the checklist to indicate that they have done the activity. Another way is using the do statement. Okay, do statement means that is an instruction that is usually focusing on positive instruction. Because why? Positive instruction appeals more to the children. So instead of we say do not hit that kid, instead we can use the words such as use your hand for simple gesture, or use your hand to pet the boy. Just a simple pet. instead of saying don't. Okay, another one is praise for good behavior. Like I said just now for the do statement, every negative statement such as no or don't or anything that is cannot be done need to be met with at least or just at least more than one for positive reinforcement. Okay, positive reinforcement, in other words, is specific feedback can increase children awareness on desired. For example, in a feeding situation, okay, for the feeding situation, let's say the children likes to throw away food. Okay, we as an adult will definitely say no. So after the say no, the children will realize that he should not be doing that. So if the children is adhering to your instruction by not throwing the food after that, we can give them reward. So this reward is called positive reinforcement. Reward can be anything, including the children's favorite snacks, the children's favorite drinks, or moral support such as good job or just a simple high five. Anything is can be done as long as it's a positive behavior. So make them stop the inappropriate behavior by saying no, and the children is adhering by doing the good behavior, then we can give them reinforcement. The reinforcement is called positive reinforcement. Okay, another one and last one is keeping perspective. All the initial steps to handle and how to reduce needs to be done by surrounding adult. Means that if the parents is doing this, but the other adults such as the uncle, grandparents is not doing it, the children will realize that they can run to those adults to not continue the activity. This will make the behavior, the specific behaviors such as the escaping, reinforced because the adult does not comply to the strategies that was done by the parent. Supporting good behavior, there are three main categories. The first one is general strategies, general support strategies, and lastly is supporting specific strategies. I will explain one by one on this. For the first one is the general strategies. The first one is meeting sensory needs, and the other one is building new skills. So meeting sensory need, as I said before, if the children have a specific sensory issue, you can translate into two, whether the children is sensation seeking or sensation avoidant. Careful consideration is needed because the specific stimulus can cause behavior issue for the children. So if the specific stimuli is known for the parents, they can control the frequency and the duration of the exposure towards the children to minimize the behavior issue. Okay, another one is building new skills. Okay, building new skills is basically what I said just now. Let's say the age group of children 2 to 3 years old, but still unable to do 4 to 5 pieces of puzzle. So what they can do is identify first where is the skill lies. Let's say the children can still do the puzzle, however, only limited to 1 to 2 pieces of puzzle. So what can the adult do is instead of just throw 4 to 5 pieces of puzzle to the children, start slow. Means that 1, 2, and then 3 pieces of puzzle. Start minimal, and then to the 4 to 5, 6 puzzle. Under general support strategies, there are 4 main items. The first one is providing extra time. Why is it important? When you give an instruction, a new instruction for the children, you need to give them extra time for them to be able to process the instruction to produce an appropriate response, or in other words, a correct response. Okay, another one is provide encouragement. Okay, encouragement is very important for the children because we as an adult can provide them belief for the child's ability to succeed in an activity. In other words, moral support. So don't be shy. As an adult, we need to give them plenty of moral support to guide them and to increase their participation in the activity to make them better. So another one is explicit instruction. Explicit instruction means that you need to keep the instruction that is given to them simple and straight, not lengthy, because if it's lengthy, the children will not be able to understand. It says simple and straight to the point instruction on how to do an activity. So let's say there are several steps to do the activity. Let's say 1, 2, 3, 4, 5, 6 steps of activity. Focus on the first steps and then just try to elaborate as simple as possible. Let's say the activity transfer the item from point A to point B by moving through la 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 la. Instead of saying that, just say, okay, children, take this, carry it over here. Yeah, just like that. A very simple to make them understand. That is the most important one. Okay, and lastly is specific feedback. Okay, specific feedback is basically we can give them feedback on how to improve the performance during play. For example, we are doing basic concept activity. Okay, let's say the color matching is using ice cream sticks and a box that is contain a lot of color. The children is able to do putting the ice cream stick inside the box, but without following the color. So we as an adult can try guiding the children to make them follow the color scheme. For example, red color ice cream stick into red holes. Okay, lastly, for the specific strategies, there are 5 main things. So the first one is contingency method. Okay, offering reward or token economies to help participate in the activity. So let's say the children does not want to do it. The activity is a bit too hard for them. So what we as an adult can do is offer them reward. So like I said before, can offer them favorite snacks or favorite drinks or favorite candy, etc. However, need to be reminded that it is not the reward is not to be given as a whole. You need to give them bit by bit. Okay. So the next one is positive reinforcement. Okay, positive reinforcement is a very powerful behavior change technique that can be misused. If you guys remember the situation that I mentioned before, initial steps to handle the keeping in perspective. Okay, the grandfather or the uncle taken the children away from the activity when the parent is asking the children to do it. So that thing is called positive reinforcement on inappropriate behavior. So what that means is that the adult that is around that children actively supporting the inappropriate behavior, which can lead into strengthening of the inappropriate behavior. If there is something like that, we need to make sure the behavior is firstly appropriate before we can give them positive reinforcement. Okay, another one, addressing transition. Okay, addressing transition is also mentioned previously at the daily activity checklist. Okay, here we have one of them is transition routine, video schedules, timer, and lastly is representational object. So for transition routine is almost the same as visual schedule where we can set a routine for the children to change their activity. For example, let's say if the children after finish playing, the toys is messed up. So we as an adult can maybe sing a song like clean up song to make them stop playing and start cleaning up the toys. That is what they call routine. It can be anything. So another one is timer. So timer is function also the same. Instead of doing a routine, we do a simple timer for 1 to 2 minutes, and then after the bell rings, it's supposed to indicate the time's up for the children to stop playing and keep the toys. Same also for the representational object. Okay, next one is token economies. Okay, for token economies, each token is in turn for good behavior. Means here is that every good behavior can be rewarded by using token economy, where we can use a sticker. So we can do a 2x4 box, and then at the end of the box, we can show, okay, this is the reward that the children can get if he is behaving 4 times. He is behaving on hour 1, he is behaving on activity 2, he is behaving on activity 3, and then 4, and then he can get the reward. The reward can be anything, like I said before, either favorite snack, drink, or etc. Okay, lastly, preferred and non-preferred. As a children, there are many likes and dislikes. So it is up for the adult to identify which for the children likes and which of the children dislike, so that when start of the activity can start with the like activity that is segmented, means that when the children is doing the activity as a whole, instead of as a whole, they need to segment it, and then afterward can combine it with the non-preferred activity. So back to the car situation, where the children likes to play car. However, when he played the car, he also does not like to do fine motor activity such as writing, for example. What can the parent do is that while playing the car, let's say they are playing the car from point A to point B, and then at the point B there's a fine motor game, a mini fine motor game. After they reach that point, they need to do the fine motor games, and then after they finish the fine motor game, then they can continue the car game. So this is what I meant by preferred and non-preferred activity. Combine it together and doing it seamlessly. All right. So that's all. Thank you for lending me your ear. So is there any question you guys can leave on the comment down below.